This here is the humerus. It is the longest and the strongest bone in the upper extremity. We can see the anatomical position of the humerus by studying this rounded surface which forms 1/3 of a spear, and it is present medially, upward and backward in the shoulder joints. The other point to understand the anatomical position is to see the greater tubercle and the lesser tubercle are present anteriorly to the face, and then we'll have to see the olecranon fossa which is present posteriorly. Now the humerus can basically be divided into three parts. The upper part consists of this round head which forms the 1/3 of a spear. Then we'll find necks. Now here we study three types of neck. The anatomical head which is present here. Then we come to the morphological head which is present between the diaphysis and the epiphysis, and then we'll go for the surgical head. This is very important because various important veins and arteries passes through this position. The third part in the humerus bone, in the upper end of the humerus bone, is the greater tubercle, and beside it is the fourth part called known as the lesser tubercle, and between these tubercle is the intertubercular space. Now the muscles which attach to the greater tubercle have an acronym called SIT. S is the supraspinatus, I stands for infraspinatus, and T stands for teres minor. Now the elements which form the lower end of the humerus is here is the radial fossa, here is the coronoid fossa, beneath the radial fossa is the capitulum, and here is the trochlea. Now this is known as the lateral epicondyle, and this is the medial epicondyle, and beneath this posteriorly is the olecranon fossa. Now we'll see the three surfaces of the humerus bone. In the front, you can see the anterior lateral border, and here we can see the anterior medial border, and then we have the posterior border. The anterior lateral border can be identified with the help of this deltoid tuberosity, which is V-shaped, and here we can see the intertubercular circus, and here we can definitely see the olecranon fossa, and this is the posterior surface.